Hi everyone, welcome to this series of presentations on evidence-based practice in exercise science and health promotion. In this presentation, we're going to learn what EBP is, how we can use this set of skills to enhance our ability to provide services to our clients, our athletes, to the organization that we work for. Practicing EBP is really important as we're all professionals and we're all attempting to utilize the best research, best evidence that's out there to make decisions that we're going to use every day in designing programs, in enhancing the human performance of the athletes we work with, or improving the health and wellness of the clients that trust us to do this. So anyway, let's learn more about evidence-based practice and how you can use it to enhance your professional abilities. So what is evidence-based practice? In a nutshell, it's utilizing information that's out there to guide our professional, clinical, practical decisions. We're faced with decisions every day as healthcare professionals, as exercise science professionals, as people working in health and wellness. We have decisions to make. We have options. Do we recommend this diet to our clients or that diet? Do we recommend this type of training program or that type of training program? So we're faced with these kinds of decisions all of the time. And when we make these decisions, they have significant impact on the people we work with. So we have to make sure that we're always making decisions based on the best evidence that we have available to us. This evidence doesn't just mean reading research articles. It means talking to professionals, experts in the field, looking at past practices, and also understanding the interests of the clients or the athletes or the patients that you work with. Let me start with a story, and I like to think of this as enlightened skepticism, right? We have a way that we do things right now. If we're going to change it, we have to be skeptical of changing it. We have to think about, does this make sense? Is this going to work? And so on. I remember back in the day, I grew up working football as an athletic trainer. Like, my professional background was working a lot of football at Penn State, West Virginia, NC State, and so on. And this is what we did during warm-up back in the 80s and 90s, right? The football team all lined up. They spread out in a really organized fashion, and whoever was the best counter would sit up front, usually a team captain, right? And would count, as everybody stretched their hamstrings for 10 seconds and then stretched their quads for 10 seconds. And we did this in a very organized fashion. Meanwhile, in Europe, soccer players were doing this goofy stuff, right? They're doing little dances. They're running around doing high kicks and high knees and whatever. Looked really ridiculous to me at the time. But now we find out in looking at the literature, this type of warm-up, a dynamic warm-up, really taking the body through a range of motion dynamically, is a better warm-up for preparing a person for physical activity, potentially reducing injury, and so on. So they weren't so goofy after all. So this would be a question you potentially would have. Hey, should I do this type of warm-up, focusing on static stretching, or should I do a dynamic warm-up? Maybe you're a new coach for a team. You want to know what the right answer is? Well, you should do some research, and the research will give you a very clear answer that the dynamic warm-up is superior to the static stretching warm-up. So evidence-based practice is this enlightened skepticism. When we see something new, a new piece of equipment, a new technique, or whatever, we want to know if this is maybe the best thing to use for our clients. We need to go out and find information on that technique, that piece of equipment, and use that evidence to make these decisions. So evidence-based practice is that, using information to make decisions on how we're going to interact with our athletes, our clients, and so on, and what recommendations we're going to make to them. So let's take a closer look at the specifics of what EBP is. So evidence-based practice is basically, it's also known as evidence-based medicine. You'll hear the terms used interchangeably. Since exercise science and health promotion individuals necessarily aren't doing medicine, practice is the best choice for us. But you will see, if you're interested in the topic and you search evidence-based medicine, you see the same basic framework for how to apply it to making medical decisions for patients, etc. So practitioners are always making decisions that affect client outcomes, right? You're deciding, hey, should I do a high-intensity interval training program for this person? Should I do a kind of just a moderate, long endurance training with this individual and so on to bring about the change that they want to help them meet their goals. So you're making decisions all the time. We can't just make those decisions based upon a cookie cutter, this is what we've done in the past, it's always worked. We need to constantly be questioning what we're doing and looking if there's better ways to do things, whether it be more efficient, taking less time, or doesn't need as much equipment, or whatever it may be. So we should always be trying to integrate the best available information that's out there into making these decisions. As an athletic trainer, this was pretty simple for me because we were always being presented with something new, a new injury, right, or a new rehab program. Well, you are too. Health and and fitness individuals, we're constantly being bombarded with the newest way to do this thing, the newest piece of equipment, the greatest supplement, and this is 100% effective, and all of these crazy claims that you find on the internet, right? Well, some of those claims might be accurate. We don't know, though, until we start to look at the literature and delve into the research and talk to experts in the field to really know, will these things work? So evidence-based practice is a set of steps and skills that will allow you to evaluate these types of claims to then inform your best practices, to say, hey, this is something that I should utilize with my clients in helping them improve their knee strength, to help reduce the risk of falls, to help them lose weight, whatever it may be, whatever their goals may be. So that's what evidence-based practice is, looking at the broad picture. Evidence-based practice is not just randomly reading the research that's out there, picking up your journal that came this week and reading it. Not that that's not a really good thing for you to do professionally, but that's not what evidence-based practice is. It's also not just reading up on the internet, following your favorite podcasts or blogs and talking to your colleagues on breaks, right? That's still a great place to get information, to gather ideas, and advance yourself professionally. But that's not what evidence-based practice is. Evidence-based practice is coming up with a very specific question that you want to research and get an answer to, and then apply to your clients, your patients, your athletes, etc. So those are great practices to have, but they are not what evidence-based practice is. So evidence-based practice is this enlightened skepticism. So I'm skeptical of anything new until I can prove, or gather enough evidence to say, hey, this might work for me and my clients. So evidence-based practice is a systematic method that's used to determine the best practices with a given population. So it incorporates a number of things. I don't want you to think that this is just, hey, this is a research class and therefore Tom's really going to present me with the importance of reading research. That's part of it. So evidence-based practice involves finding the best available evidence. So that is going out into and doing a literature search to see what research is out there on that specific piece of equipment, that specific technique, whatever it may be. It also includes clinical expertise. So you don't have to throw out all the things you've been doing in the past and your past experience. You still, when you're making these decisions, can utilize the clinical expertise that you have, as well as experts in the field. Now, we have to be careful in the term expert. I'm doing air quotes right now. Some people truly are experts because they do EBP all the time. They're always reading. They're practicing this enlightened skepticism. But then other experts are not experts, but they pose as experts. So we have to be careful there. We also involve patient preferences in our decision making for evidence-based practice. If we come up with the very best exercise program, but we know our clients aren't going to do it because it's too lengthy in time or requires equipment they don't have access to, it's not going to work. So we also have to incorporate patient preferences in EBP. So EBP involves all three of those things: finding the best evidence, looking at clinical expertise and recommendations, and then also incorporating patient preferences. So, I don't want to scare you on evidence-based practice. It's not as hard as it may seem as we go through this presentation. After you've done this type of practice several times, it gets easier and easier. But why should we do it? It is sort of an extra step and somewhat time consuming in if you truly are following an evidence-based practice model. But I really think it's the best way to continually hone your skills, continually advance yourself professionally, and really make yourself an expert in our field. So why do it? One is there is so much research out there. It is impossible now to keep up with all of the journals that are out there and all of these new ideas and best practices. So we can't read it all. So we have to be focused and intelligent in how we approach the research that's out there and answering questions. I think we also should practice evidence-based practice because it is a constant quest for the best care. How can we provide the best services to our clients, our athletes, etc.? And by doing so, we will constantly hone our skills and become experts. I think that will have an impact on you professionally. I think that will improve your effectiveness. That will improve your reputation, probably improve what you can charge clients per hour, or increase your salary, your worth to your employer, etc. So I think it has a lot of both professional benefits, but also personal benefits. It can save lives. A lot of times we're dealing with questions about how to improve a person's health, how to improve their wellness. That can provide extra years of living. It can save lives in the long run by improving the health of our clients. So that's important. It can prevent injuries or illnesses, disease, etc. It can avoid treatments or the purchase of equipment that doesn't really work, right? It can avoid, wasting your time or money on techniques or equipment that has little to no effect. And it also can be a cost and time savings for you, right? So, you aren't wasting time on doing treatments or using techniques that aren't going to have much benefit. You can really focus on using the training programs, the exercises that are going to give you the most bang for your buck, going to be the most beneficial for your clients, and so on. So we really want to get into this mindset that we're going to constantly, as we go through our professional lives, be asking ourselves these questions, trying to find the answer, and continually be advancing and honing our skills.